Our passion didn't start with the mouth. It started with people, with the well-being of the profession, and if you're like me, maybe a little bit of your nerdiness in all things tech too. We all want to love what we do, but the truth is, burnout, people problems, and glass ceilings can keep us from doing what we set out to do. So let's get back to the heart of connection. Welcome to the Dental Handoff. This show is about passing you the knowledge, the habits, the systems, and the strategies to lead your teams, lean on the tech, and listen to your gut while you take care of teeth. And let's get honest, the overall health of our communities. Let's stop using the wrong end of the toothbrush, y'all. My name is Dr. Kelly Tanner. Oh, and uniquely, I'm a dental hygienist too. You can consider me a guru in the dental and leadership industry. With over 3 decades of experience, my goal is to take you to the next level by empowering growth, perspective, and confidence. By identifying the gaps, recognizing the plaque, and extracting the truth with other experts in the field. I'll share their stories, empower you to own yours, and elevate your passion in the process. So have a seat in the chair, put on your bib, and let's get to work. Hello, everyone. Welcome to the Dental Handoff. I am your hostess, Dr. Kelly Tanner, RDH, and I hope everyone has had a wonderful week. Today, I have with me my friend, Chrissy Harlow. Hi, Chrissy. Thanks for being with us. And you're going to see her lovely nature in the background. And I've met Chrissy not long ago, and we met at an event, and I thought that her story would resonate with a lot of you all about where she is in her journey and what her thoughts are, what her next steps are. So that's why I asked Chrissy to come on to the Dental Handoff to share where she is, what her thoughts are, what her path is, and how she's connected the dots up to this point of where she's at. So Chrissy, tell us about you and why dental hygiene.
Hi. So I chose dental hygiene back a long time ago. I've been a hygienist for 19 years. And I chose it because I wanted to work in healthcare. I originally wanted to be a pediatrician specializing in oncology. That was never going to be my path. I don't think I could see sick children die. And I figured it out by my senior year in high school, but it honestly went from third grade all the way up to my senior year in high school. That's what I was going to do. Luckily, I had other people in my life that were in the dental field that kind of said, hey, yeah, I love this. This is what I think this is an amazing thing. I wanted to work with my hands. I wanted to work with people. And it just led me down the path of dentistry, dental assisting, and then dental hygiene. Yeah.
Cool. So the people connection.
Yeah, absolutely.
Yeah. And then tell us what you're doing now.
So during the pandemic, I went back to school to finish my degree in my bachelors for dental hygiene. And I said, hey, I need to figure out what else I want to do in my life. And if I love clinical dental hygiene, it is my passion. I love educating patients. I love being a part of it. But I've also been in a few offices that have been not ideal, we'll just say that. And I really would love to be able to help people, help dentists, help offices understand how to work with each other a little bit better, empower them to be able to see each other in the best light and figure out how to all work together and make it the best environment for everybody.
Yeah. So when you went back to school, because a lot of folks come to me, should I go back? Should I take the next step? What would be your advice there?
I think it's absolutely the right choice to go back to school. I mean, it did take me, a while for that to happen. But in the end, I think getting the knowledge, getting the experience, learning how to research more, learning how to write papers again, figuring out how to talk to people in a more professional environment has made all the difference in the world for me.
Awesome.
I still have 1 year left. Still working on it.
Well, cool. And, a lot of times it's just a decision to go forward and move forward in that path. And, is it always the right time? Is it ever, you try to choose all the things based on where you are in your life. And is this the right way forward? So you started and here you are. And it sounds like you're glad that you did it as well.
I'm super excited about it. I'm happy to be almost done with this chapter, and who knows, I might go on to getting my master's too, because it's, whatever feels right in the moment.
Yeah. And, you'll know when it's time. I
Yeah.
think that's what I always tell people. You'll just know, you get through this. And sometimes you know before, but it's hard to know all the variables and context of where you'll be when that's done and you're ready for the next step
Absolutely.
too.
Absolutely.
With where you're headed next, because Chrissy and I had the opportunity after we met at a meeting to connect, and she shared her journey. And would you mind telling people like where you are with deciding where all of that is and where you're going to go next? Because I think that this part is intriguing, and so many people are in this exact space that you're
Right.
in right now. And that's why I was like, everyone can benefit from hearing where you are.
Right. So my goal with going back to school, my goal with what I want to do with my life, outside of clinical dental hygiene, is I would love to be a speaker or a consultant, and I would love to be able to spread what I feel passionate about and what I really love, to other people. And I asked Kelly too when we spoke. I was like, what do you think? What are my options? What do I need to do? How do I move forward with this? Because I think everybody gets stuck into this. I'm scared. Oh, nobody's going to listen to me. Oh, I don't know what I want to do. Oh, I'm not sure. And honestly, listening to a lot of your podcasts has made me kind of get more excited about things, saying yes to more opportunities and trying to just put yourself out there. My next steps are, I am going to write some Instagram posts, and put out 10 tips of how to empower your dental office, and try and just kind of lay out some base models for that and see how that plays out, and just write some papers and see if I can submit things even locally to some of my dental hygiene study clubs, and see what plays out with that.
So you just, because when we spoke, I don't know where to get started, right?
Yeah.
How do I even take that first step?
Right.
And what Chrissy and I talk through, and what I encourage you to do, is figure out what really lights you up, what makes you feel good. And in that, you get that clarity and purpose. And when you know your clarity and purpose, everything else kind of falls away as to what's not an option for you. So once she identified that, it's okay, where do you start with what you know? How can I and what can I do to start to move forward? And so she decided, like just like she's sharing with you, to start creating Instagram posts. Chrissy, what will your Instagram handle be, or what is it?
It's Dental Friend.
Okay, so you just go to, and she's getting ready to change her page over. But this is such a unique part of the process where when you realize that you want to move into something different, like she was sharing with me before we got on, and Chrissy, I hope you're okay with us sharing this,
Oh
because
yeah,
I loved you
absolutely.
being on here too, because she wants to share her vulnerability with our audience of, how do I go from my personal page
Hmm.
to a business page? And then Instagram, what people love to see is they love to know about you, not just what you do and the services you offer and the content you're pushing out, but also you. They want to get to know what you're about and to make it more personal. And I think too, what's happened during COVID and post COVID, where we are now, is that we got to know each other a lot on social media, and then we would link up
Right.
on different platforms. And it's almost like, even though you've never met someone, you feel like you know them because of their personality. It's come through. And I don't know about our listeners here, but when I'm out and I'm traveling and speaking, people say, "Oh, your kids are getting so big. It's so good to see. How is it?" Because people are truly wanting to follow your story. So, you know, be who you are within the realm of what it is you want to put out there. Obviously, sometimes it's not everything, like Christy was saying. I probably need to take a few things down, and that's cool. But
Yeah.
be who you are. And she said she's just going, I was like, "Do you have 10 tips that you can give people?" Start there. And so that's where she's going to start, because it can seem so overwhelming because you're looking at the entire staircase. And all you really need to focus on is that first step to get through.
Absolutely. Yeah. Absolutely. I've got my little book out, started writing down my 10 tips, and just, kind of thinking in my head how I want to present it out there. And I'm cleaning up my my page, my private page. I have 3 Instagram pages. One's for my dogs. So, and then I have one that's just purely running, and then I have my private one, which has been Dental Friend from the beginning. And I think it's a good name to put out there for this
Yeah,
content.
I love the name. It's brilliant.
Yeah,
And so with that, I think too, another point is that we can get very caught up in overthinking about it. Like, is it the
absolutely.
right time? Is it the right name? Should I have something better? But if you already have followers too, and I've been through a lot of Instagram training, and then also my friend Allison Lecusier with Clearly IG Coaching, they do a lot with Instagram training. They'll take over Instagrams for companies to help folks do that, but they just do one-on-one trainings or trainings with teams
Mhm.
to help out audiences and companies get started wherever you are. And those are some of the things that I learned from her. It's just start where you are, build it, and then truly, you guys, every single thing that you do every day, even if it's just for 15 minutes, tweaking your Instagram and making it public is a step in the right direction. It's
Right,
not overwhelming at all because we think of it as, oh, and there's so much to do because we start to compare ourselves
right.
to other people like, man, I only have like 50 followers. How am I ever going to do this? Well, we all started that day that we thought of it. And the best advice that I kept getting over and over again was start today. Because in a year, you're going to look back and say, I'm so glad I started that day. Because every day that you delay beyond that is going to be another day that you're not going to be where you are.
Exactly. Exactly.
So then tell people how it is that you decided like Dental Friend and what it is that you want to offer and what your courses are, or even if you haven't decided everything, like tell them your thought process if you wouldn't
Yeah.
mind.
So, Dental Friend actually is a handle that I've had for a long time, just because I am my not, most of my friend group is not in the dental community. I mean, I have my dental friends for sure, but most of my friends, I've met through other things, and so I have been the dental friend, the one who talks dentistry, who is passionate about dentistry. And that's how most of my friends know, oh yeah, Chrissy's the dentist person. She's the dental one. You have questions about this, come ask Chrissy. She'll set you straight on stuff. So they know, most of my good friends and family know that I'm super passionate about what I do. So it kind of, it evolved into that. And I was like, oh, okay, this is what I named myself back, I don't know, 20 years ago. So, um, so from that, I kind of want to make the page. I want to brand myself as somebody who is passionate about patient education, and then also about making the workplace environment something that people want to come to and want to be a part of. So I think it's really important that when you're at work that you're happy, because we spend so much time in a work environment that it's it's so sad when I see coworkers or friends who are in the dental community that are just sad or upset, or when I've been in situations where I've been frustrated about the situation, and not knowing how to talk to people, or talk to the owners, the dentists, the managers, and figure out a way to make it so I get what I need and they get what they need, and it's a good environment for everybody. So
So
I
when they come to you, Chrissy, and they say, I'm feeling like I'm defeated when I this is happening in the office. There's a lot of drama. Is there any one thing that you would say to those individuals and give advice here?
Yeah, a lot of times drama comes from people misunderstanding each other. I really think that, and I think if the people who are having the drama issues, if they can actually have a sit down one on one with each other in a non confrontational way, like in a way that they can both be open to each other, I think that the information that you can get from each other, and the background to why people irritate each other in a certain way, can be once you figure out like how people interact with each other, it's just a whole game changer. You're like, oh, this person gets irritated because she's type A and she needs to have things in a certain direction. Okay, well, I don't care that much about that. So I'm going to come over here and let her have her type A moment. And I'm going to just flow out of that and be okay. And she's going to understand that maybe I'm not as concerned about everything. I am concerned about how things work, but I'm not as concerned about it being in this direct order. So once you understand each other, I think it makes all the difference in the world.
100%. And that is such sage advice too, because I think that creating that communication and that connection of, and I was just speaking on this yesterday, understanding your gifts. Like if you had what are the three things that people say about you? Like, how would they describe you? And then, because those are your gifts, people that always say, yeah, I always know I can count on Chrissy to give me advice, to be honest, to whatever. Those are your gifts. And
Right.
then once you learn to how people communicate and how they look when they're stressed, when you open up that communication to talk about all the things that when you're seeing, when I, it's like when I look at you during the day and we're part of a dental team, how do I know that Chrissy's stressed? Well, Chrissy's going to tell me what she looks like when she's stressed. And
Right.
so I would know that about her and not to approach her with new information. And that's what we did with that activity yesterday. What are your gifts? And then how do you communicate? Let's talk about your team as a team activity to say, how can I improve this? Because you know why they're doing things. It's not always that you understand it, but you have, or at the moment, like what they're thinking, because you can't, because you're not them. But
Right.
if you can understand like where they're coming from, it's just less drama.
Absolutely. Absolutely. And seeing another perspective is always the biggest thing. Like not me. It's it's the whole team. You have to look at everybody and see where everybody's coming from because it's a whole world out there. And the quiet ones, oh my gosh, they have the most going on.
Yeah, tell me more about that.
I have found that my quiet coworkers, and I'm not quiet, so you probably can tell that about me. My quiet coworkers are, they're usually the ones who are either contemplating things all the time. They're very methodical and but they're in their own headspace, or they're the ones who are like dreaming up all kinds of different scenarios in their head, and sometimes I'm like, oh, come let it out so I can figure out what. Talk to me. Like I always tell people, if there's ever an issue with me personally, come talk to me. I promise I will listen to what it is and try and figure out what the problem is, because we're not perfect. Nobody's perfect, and we all have, and there will always be moments where people butt heads a little bit here and there, but you have to be able to talk about it and figure it out and be able to work with each other. And I think that's how you make a team that's going to be productive and happy. I mean, you want to be happy while you're working.
Yeah. I mean, you spend so much time there. And again, so, to keep that open mind, to encourage those courageous conversations, to pull that information out to say, hey, what are your thoughts on this? And
Right.
to engage that quiet person.
Absolutely. Absolutely.
And two, it's to your point, it's to create those teams that are going to stick together and be there for the long run. And that conflict that arises, people think that conflict can be a bad thing, but conflict leads to understanding. Even if you don't agree, it helps you understand the other person's vantage point, because we
Exactly.
all make decisions based on what our past experiences are, that situation, that's called situational leadership, and then how it is that you're going to put those things together to then act and react. But it's important too to first hear all sides of it and to understand, to create understanding of, oh, I didn't think about that from that angle. It's always an
Right.
enlightening process.
As long as you keep an open mind while you're having conversations with people, and that's the big thing. If you're closed off and are like, it's only my way or the highway, then it's not gonna work.
Yeah, you got to get out of that self. And also too, thinking that there's a different, this came up yesterday and in a conference I was speaking at, and the context is that the newer generation is lazy, or the newer generation is more apathetic, or whatever. I think I don't personally believe that because I've seen just the opposite. I see how engaged they are. But then I was thinking about, man, when I was that age coming into the profession, I was probably like that because I was scared to death to make a mistake
Right.
in front of people who have been doing this for a while. So I think we can get stuck in our limiting beliefs about how certain people are, or especially now with turnover of teams, you have
Oh, yeah.
the people who have been there and then the new people, and the new people are trying to please the people who've been there, and then and the people who've been there are like, oh man, why I can do things 10 times as fast, I'll just do it myself, and that doesn't create a culture of trust.
Exactly. I mean, that's pretty much what I've been dumped into recently. I just started an office 2 months ago. The other hygienist had been there for a really long time. Her the dentist that I work for now bought the practice 6 years ago, and the my co-hygienist is young. She's been a hygienist for 3 years. She's amazing. She does a phenomenal job, and she's really good at talking to patients. However, what she told me was that she didn't really talk to patients as much as she did until I came. Our office is tiny. It's really, really small. You can hear every conversation in there. Like nobody, you can't not know what's going on in the next room because it's just
Wow.
a tiny little office. And she said, once I came and started talking to patients and really educating them on stuff, then she got her cued that she could do that. The previous hygienist didn't talk to people as much. About patient care, about things going on in their mouth and periodontal disease and all that kind of stuff. And so when I came and started talking to patients about it, she kind of caught her cues, which is what happens when you're young and you're still trying to figure out how to navigate your dental career. So I felt really great that she was able to have takeaways from me, and I just think she's amazing. I think she's a great hygienist, and I think she's doing everything that she should be doing. So it makes me happy.
Yeah, and I love that you bring that up too, because you're exactly right. You're trying to follow other people's leads, those verbal and nonverbal cues that people are using to feel like, okay, this is acceptable behavior, this is a direction I should go in, or ooh, that's not as accepted here. Maybe I need to stay over here in this lane. So it's and being open to understand why that person may not be engaging like you would expect for them to, because they are learning and they don't want to upset the apple cart. And it's eye opening, I think, when you try to put yourself with that empathy in that person's shoes. It's not the generation.
Right.
I strongly disbelieve. I've seen everything to tell me that it's definitely not the generation. This
Right.
generation is an amazing workforce and habit. It's that we think that they're going to jump in. I think a lot of it's us.
Right. We get set in our ways, and that's something that I think in general people have to kind of shake things up a little bit and kind of, okay, don't get set in that. You got to move forward and see people for who they really are. Yeah.
Yeah, absolutely. There's a lot to learn from a fresh perspective.
Absolutely.
And just like you, Chrissy, I mean, you're an individual with 19 years of experience, and you're coming into a newer situation. You're not a new person, but you're new to the practice, and a lot of that is happening right now. So, what kind of advice would you give someone who's new to the practice, new to practice? Maybe they're a little more seasoned, but how to engage in that conversation so there is that understanding of, I know that we're working together.
Right. I think being vulnerable too, a little bit, like knowing, you may know a lot about everything that you know everything about, but you don't know how the culture in that office is yet. And so being open to being like, hey, how do you guys do this? Or talk to me about how this happens, or tell me how patients are scheduled, or tell me how do we talk about periodontal disease in here, and have that conversation. And it may not be everything that you are used to, and then have a conversation about, hey, can we look at changing things here? Or how can we baby step it into what's going to be comfortable for all sides? Because coming in this office, it wasn't exactly how I wanted it to be, and we are slowly moving in a direction that is comfortable for everybody to kind of move into good patient education, a good perio program for our patients, a good good overall aesthetic for everybody, so that we're all happy. We're all doing the things that make us happy and are comfortable with.
Yeah, that's great advice, and it's an imperfect process.
Right.
Because as soon as you think you understand, you realize something else because we all have our blind spots, and it's like, oh, I didn't think about that. Okay,
Right.
cool. And so I think it's an evolution of, it's not just a one and done conversation. It's continual communication about the understanding and how you bring it all together to serve the patients, to put them at the center of the care, because that's why we're there. Because when we start to shut down and when we start to get away from our why, we're like, oh, I'm just not going to worry, but I'm just going to do this. Well, that's not really serving your patient. Your patient can sense the fact that you guys are butting heads, or that you're
Absolutely.
not, and that
Yeah.
you're not aligned, and they're like, what is going on?
It's a definite feeling in office when you walk in and the team members are not happy with each other. You can feel it.
Yeah.
Yeah.
Well, I so appreciate you sharing your story today with us and your vulnerability on your journey. And again, I talk to so many people throughout the week, throughout the months, the year, that are exactly where you are. So I knew that what you had to say would lend some conversation, some perspective about where you are. And so, Chrissy, if people want to reach out to you to say, Chrissy, tell me more about this, and tell me, link up with Dental Friend, how would they
Right.
get in touch with you?
You can find me on Instagram. It will be public soon, at Dental Friend. It's all one word. Or you're welcome to email me at charlow520@yahoo.com.
And her information will be in the show notes this week for you all to reach out to Chrissy. Chrissy, thank you again so much for your expertise, for your insight, and the many
Absolutely.
years
Thank you,
that,
Kelly. You've been amazing. I've really, you reaching out to me and us being able to talk has really kind of pushed me forward for sure.
oh, well, thank you. This is what it's all about, making the impact with people so you can just perpetuate the change and empower each other and say, come on, let me show you everything. Let me show you everything that I've done, that not that it's perfect, but you can learn from that. I've learned from it, and you can't be scared where you are. You just got to go through it to get to the other
Right.
side.
Right.
So, well, to our listeners, thank you so much for listening in and for subscribing also to the Dental Handoff. We would appreciate it if you would do me a favor to give us a 5-star rating on Apple. And thank you so much, and we will see you next week. Be well, everyone.